and welcome to our show Health and Wellness Myths versus Facts. I'm Gargi Rawat. This show focuses on understanding hormonal health. Endocrine glands produce and secrete hormones that are responsible for many important body functions. They play a vital role in the functioning of the body and determine if one develops diabetes, thyroid disease, growth disorders, and a host of other hormone-related disorders. How often does one even consider or track the health of one's adrenal glands when one considers their health status? The sad fact is that adrenal health is largely overlooked. The role of the adrenal glands in the body is to release certain hormones directly into the bloodstream, and these hormones determine how the body responds to stress, and some are vital for existence. Adrenal health needs to be given importance to ensure overall health, as it would help to avoid various health complications associated with their dysfunction. So today we have an expert panel with us which will provide medically accurate and actionable advice to help prevent the development of adrenal disorders, as well as guide our viewers with effective long-term management strategies. We're joined on the show today by Dr. Pramila Kalra, Professor and Head, Department of Endocrinology, Ramaya Medical College and Hospitals, Bengaluru; Dr. Pramod Gandhi, Consultant Endocrinologist, Director, Kingsway Hospitals, Nagpur; and Dr. Tushar Bandgar, Consultant Endocrinologist, the Endocrine Clinic, and Professor, Department of Endocrinology, KEM Hospital in Mumbai. Thank you so much, doctors, for joining us on the show today to talk about this often overlooked issue of hormone and its relation to our health. Dr. Kalra, I'd like to start with you. Which hormones are secreted by the adrenal glands, and what is the role of these hormones in the body?
Yeah, adrenal glands are very important for the normal functioning of the body, and we have two adrenal glands, right and left, which are situated just above the kidneys. And these adrenal glands have two parts. One is the cortex and one is the medulla. Now, the cortex secretes three hormones, and among them the predominant are cortisol hormone, which is the basic hormone which maintains the normal metabolism of carbohydrates, proteins and fats. Also, we have another hormone called as aldosterone, which is important for maintaining the salt balance and the blood pressure of the body. Then we have another hormone called as DHEA, which is also important, which is a sort of an androgenic steroid, and there are various other androgenic steroids which are secreted from this cortex. Among these three hormones, cortisol is the most important because cortisol needs to be increased whenever there is a stress in the body, and it helps to maintain and help the body to fight the stress. It also maintains the sleep cycle and other parameters of the body. Also, from the medulla, we have some other hormones which are called as epinephrine and norepinephrine, which are the catecholamines. Now, these are also the type of the stress response hormones. So whenever there is a stress in the body, these hormones are secreted. They are called the fight or the flight hormones. So they help to increase the blood pressure, increase the pulse rate. All these are stress mechanisms of the body to fight the stress. So these are the various hormones which are secreted. So basically, adrenal gland is a very important gland for maintaining the normal functioning, the blood pressure, the glucose levels of the body, the sodium levels of the body. All these things are maintained by the hormones secreted by the adrenal glands.
All right. Now, Dr. Gandhi, what happens when the adrenal glands don't function normally? What are some of the more common problems related to the adrenal glands, if you could tell our viewers?
Yeah. Whenever these adrenal glands functioning is deranged or these adrenal glands are destroyed due to some other reason, there is deficiency of all these hormones, which just now you heard it. Amongst them, androgens and epinephrine, norepinephrine, if there is deficiency of these hormones can be secreted from the other glands as well. Therefore, they don't manifest clinically. However, the predominant clinical manifestations of adrenal deficiency, adrenal gland destruction, leads to cortisol deficiency as well as aldosterone deficiency. Cortisol deficiency, what we call as hypocortisolism, and aldosterone deficiency can lead to hypoaldosteronism. So these are the two hormones which manifest clinically as adrenal deficiency, adrenal insufficiency. Now, amongst that, Addisons disease is one condition where we get deficiency of these hormones, cortisol as well as aldosterone.
Right. Dr. Bandgar, how widespread are these adrenal gland problems like Addison's disease? Are these quite commonly found in Indians?
Yeah, so taking forward what Dr. Kalra and Dr. Gandhi has said about adrenal hormones, one of the most important problem with the adrenal gland deficiency is the glucocorticoid deficiency. And when you think of glucocorticoid deficiency, we should know about exogenous Cushing syndrome. Now, this particular condition occurs because there is widespread usage of steroids for various conditions like arthritis, asthma, and the person gets dependent on that particular medication. And if you really stop it in a hurry, then the patient can get into an acute hypocortisolism, which is one of the most common and widespread condition which is prevalent in our community practice now. And similar to that, if you talk of Addison's disease is a different condition, and it is due to destruction of the adrenal cortex leading to deficiency of those hormones, and they are seen, if you say about a lakh population, in a general population, 5 to 6 patients would be there who are diagnosed to have adrenal insufficiency due to Addison's disease, and one of the most common causes has been tuberculosis and fungal infection, which is more prevalent in India. And hence, if you have Addison's disease, then we need to think of these as a causative mechanism.
All right. So, Dr. Kalra, now to talk more about the symptoms, and you know how people will realize there's something wrong with their hormonal system. What are some of the symptoms that can help alert a person that he or she has Addison's disease?
Yeah, it is very important that we need to recognize the symptoms, because then only the patient will come to the doctor. So it is very important that whenever there is a lack of the hormones like cortisol in the body or the mineralocorticoids like aldosterone, so there will be the patient will feel that they are very much fatigued. So first of all, they'll come with severe fatigue. Then they may feel like they are totally not able to do any work. So they'll just feel like sitting, fatigued, not doing any work. They'll have salt craving. They may feel that they may also have some electrolyte imbalance. So sometimes the patients may have recurrent low sodium. They may have high potassium. They may also come with hyperpigmentation, because when cortisol levels go low in the body and the adrenal is not functioning properly, the pituitary secretes more hormones to increase the cortisol production, and hence there is an increase in the pigmentation. So they may tell the doctor that they are becoming dark, and they may come with low blood pressure. So they may have many episodes of low blood pressure. So if all these symptoms like the patient feeling fatigued, low blood pressure, feeling dehydrated, salt craving, not feeling like doing anything are not recognized on time, then the patient may land up in Addisonian crisis, when the patient may come with very low blood pressure in an emergency situation with low glucose values, low sodium, high potassium values, and they may also go towards unconsciousness. And some of these patients may also complain of severe loss of appetite, vomiting, they may have diarrhea. So all these are also common features which needs to be recognized on time. And if they are recognized on time, they are easily treatable with the hormone supplementation. So it is very, very important that the doctors also try to recognize these symptoms, because many a time these patients keep on going to the doctors with increased skin color, pigmentation, and low blood pressure, and they may not be recognized. So that's why it's important to have a high index of suspicion, and if recognized on time, can be treated aptly.
All right. And Dr. Gandhi, what are some of the common causes of Addison's disease, if you could explain to us?
Yeah, Addison's disease is a condition where adrenal glands are destroyed, and the common reasons for this is autoimmune destruction. The various types of autoimmune destructions like polyglandular autoimmune failure, type 1, type 2, all these are the common causes of Addison's disease. The other common and very important reason in Indian patients is tuberculosis. Infections like tuberculosis is very, very common in Indian population. So tuberculosis is the commonest reason for adrenal insufficiency in Indian population. Other infections like fungal infections and CMV infections, these are the rare conditions. Sometimes metastatic malignancies can also lead to adrenal insufficiency. Various conditions like amyloidosis or some genetic disorders can also lead to adrenal insufficiency. And rarely, bilateral adrenalectomy or adrenal gland removal for some or other reason can also lead to Addison's disease. So remember, the most common cause in Indian population is autoimmune and tuberculosis. These are the two most common conditions. Other causes are rare.
All right, and so moving on from that, Dr. Bandgar, staying with Addison's disease, but if you could tell us what are the diagnostic tests for this disease?
Yeah. So when you clinically suspect that any patient has got Addison's disease as a diagnosis, you have to do some blood works to really confirm that. As we know that it's because of low cortisol, the most important test is the cortisol, which we need to look at. It's produced from the adrenal gland. We ask for another test, which is called as ACTH, adrenocorticotropic hormone, which is produced by the pituitary. So there's a reciprocal relation between cortisol and ACTH. So if you have a low cortisol and a high levels of ACTH, then the diagnosis of Addison's disease is really made. Patients may have associated hyponatremia, so sodium level needs to be looked at. There could be hypoglycemia there. Potassium can be is high. So all these levels needs to be looked at. Sometimes what happens is that in mild cases, you may not be able to pick up low cortisol levels that easily. So you might have to do a ACTH stimulation test where a synthetic ACTH is given through intravenous route and the cortisol level is checked after an hour or so. And if your cortisol is not going above 18 microgram per deciliter, then the diagnosis is of adrenal insufficiency is really made. Once you biochemically prove that there is Addison's disease, we need to find out the cause, and hence we would ask for imaging of the adrenals. So typically we do a CT scan of the adrenals to say whether it's due to tuberculosis, whether it's due to fungal infection, or due to some tumor or hemorrhage, and so on and so forth to delineate the etiology.
All right, and Dr. Kalra, one of the questions we always ask about these diseases, is it more common in men or women, and why? And can children also suffer from Addison's disease?
Yeah, this is a very pertinent question because yes, all people can suffer, men, women and children, but it is more common in the age group of 30 to 50 years, but we can also have Addison's disease in children as well. So cause of Addison's disease in children is mostly genetic. These are various polyglandular syndromes where not only the adrenal gland is affected, but there are other endocrine organs also which are affected, like there can be type 1 diabetes, there can be thyroid problems, there can be problems with the pituitary as well. So there may be other endocrine organ involvement. But if you see in older people like 30 to 50 years of age, they are mostly, if it is autoimmune, the females are more commonly affected than males. But if it is infectious, then there may be equal preponderance in both the genders. So it all depends on the etiology, but it can affect both males, females, as well as kids. But in children, it is very important that we should try to screen for any other endocrine organ involvement when they come with the Addison's disease diagnosis or cortisol deficiency. We have to screen them for type 1 diabetes. We have to screen them for thyroid disorders. We also have to see some other deficiencies like vitamin B12 deficiency. We also have to see for celiac disease. So there are many other disorders which can be associated, and sometimes we see with autoimmune adrenal problems, myasthenia gravis that is also present. So there are various other problems which can be associated with autoimmune adrenal disease, and it's not only important to screen children for these things, and even low calcium can be there also in adults and children, both with low cortisol levels. That is called as hypoparathyroidism. So it is important that not only we screen the children, but we also screen the adults whenever they come to us with cortisol deficiency, because it's not only the adrenal which is affected. There may be a lot of other endocrine organs and other organs which may be affected because of this autoimmunity.
All right, doctors, well, thank you so much for answering those questions. We'll slip into a quick break now and return with more questions for you. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about hormones and their relation to our health, and we have our panel of doctors with us. Dr. Gandhi, we were talking about Addison's disease before we went into the break. If you could tell us what treatment options are then available for Addison's disease, and does someone have to take Addison's disease medications for a long time, and what happens if a person stops taking the medicines or is irregular?
Yeah, I think this is the most important part of our discussion today. Management of Addison's disease is very, very important because we have to treat the deficiency of these hormones, glucocorticoid as well as mineralocorticoid. Cortisol deficiency as well as aldosterone deficiency can be treated by replacing these hormones like glucocorticoid Glucocorticoids are the life-saving drugs for the patient, and patient has to take it lifelong. There is no substitute for this. When we talk about glucocorticoid therapy, it's a double-edged sword. When it is given in adequate doses and managed properly, then these are the life-saving drugs. But then if they are given in excess doses, they do have a lot of side effects also. Therefore, the treatment of Addison's disease should be done under the strict supervision of the treating endocrine physician. That's very, very important. Sometimes these patients might need mineralocorticoids in addition to glucocorticoids like hydrocortisone and prednisolone, which we used to give for patients with Addison's disease. Therefore, that's very, very important that this treatment has to be done strictly under the supervision of treating doctor. In addition to the drug replacement therapy, these patients should take adequate salt intake to have to correct the salt deficiency or sodium deficiency, which is commonly seen in patients with adrenal insufficiency. Sometimes these patients may have some illness, like acute illness like fever, nausea, vomiting, or some other illness like pneumonia or heart attack. During these illness, this is a stressful situation of the life. Therefore, during stress, these patients need to increase the doses of steroids, glucocorticoids, and that should be strictly done with the consultation of your treating doctor. So patient has to be given stress cover of steroids during any acute emergencies. So that should be done strictly under the supervision of the doctor.
All right. Now, Dr. Bandgar, moving on to another issue, what is adrenal crisis? How can this be managed?
Yeah, so if you talk of adrenal crisis, it's a emergency in the life of an adrenal insufficiency patient, where the most important cause of getting into this crisis is really missing a dose for a day or two of glucocorticoids and mineralocorticoids, which is very common. And so we need to tell and counsel our patients and the family members who are taking care of the patient not to miss a dose even for a single day. Then there are risk factors where can push the patient into adrenal crisis, where if the patient goes for surgery or any trauma or any infections which can push the patient there. And how patient comes is that they can come with dizziness, hypertension, they can come with hypoglycemia, and seizures, can go in coma. It's an emergency situations where the patient needs to be admitted under the care of a physician or an endocrinologist, where the patient needs to be given IV fluids so as to bring the blood pressure up. They would require even glucose infusion because they can get into hypoglycemia. But the most important part is that patient needs to be given intravenous or parenteral glucocorticoids and mineralocorticoids so as to get the deficiency which is back to normal. And typically it is going to take around 2 to 3 days for the patient to be indoor, post which then you can really go on tapering of the steroid dosage to come back to their original dosage. Most important part is to recognize this as early as possible, even with slightest suspicion of getting into adrenal crisis, which is an acute level of glucocorticoids which drops in the blood. The suspicion should be high and the patient should be referred to a treating doctor as early as possible, because if you don't recognize it earlier, it can be really mortal. So,
right. Well, coming back now to Addison disease, Dr. Kalra, which autoimmune conditions are associated with chronic Addison disease?
Yeah, there are a lot of other autoimmune conditions, as I was talking earlier also, which are associated with adrenal disease. So whenever the adrenal gland is affected, there can be antibodies against the other endocrine organs and other organs also. And they could be part of the autoimmune polyglandular syndrome. So why we call it polyglandular? Because multiple organs or multiple glands are involved. So it can affect like the thyroid commonly. There can be also affliction of the pituitary. It can also affect pancreas because antibodies can form against the pancreas. So these are the common ones. Also, what happens that some women can have early cessation of their periods, menstruation. They can have early menopause. This can also be because of the antibodies which form against the ovaries. So there can be antibodies against varied endocrine organs. Also, these patients may have other endocrine involvement in the form that they may have also antibodies against parathyroid gland, which can lead to low calcium level, and then they can come with symptoms of low calcium. Along with these, other autoimmunities are also possible, like they may have vitamin B12 deficiency, which is called as pernicious anemia. They may also develop myasthenia gravis. They may have some other infections also, like candidiasis, and sometimes these candidiasis can manifest very early in childhood, and that is a diagnostic thing which can tell us that this child is going to manifest other autoimmune problems later. There can be skin issues like vitiligo, like skin problems can happen. So these are all things which can happen if a patient has Addisons. So there can be multiple endocrine organs and other involvement, also autoimmune involvement in the form of pernicious anemia, myasthenia, and other things, which can manifest in these patients. So it is very important that we screen them whenever we find a patient who is having a cortisol deficiency. We need to think about all these problems, and we need to screen them for all these problems also. And the treating physician or the endocrinologist has to decide what all screening has to be done for that patient.
All right. Now, Dr. Gandhi, what are the symptoms and causes of syncope in Addison's disease?
Yes, syncope here in patients with Addison's disease is a typical feature which we see, that patient develop giddiness and sometimes fall, severe weakness. The common reasons for this syncope are these patients do have hyponatremia or low sodium levels that can cause giddiness or syncope. Hypoglycemia or low blood sugar levels can also cause giddiness, weakness, and sometimes fall. Rarely these patients can also develop hypotension or low blood pressure. So these are the common reasons why patient can develop syncope in patients with Addison's disease or hypocortisolism.
All right, and finally, Dr. Bandgar, it is, the heat wave in some parts of the country, very hot weather. So what should patients with Addison's disease be advised to do in hot weather?
So as gathered from all our discussion, we have understood that there is low level of sodium in the blood and there is hypovolemia, which is predominant features of Addison's disease. So especially in a heat wave kind of scenario, there's a chance of getting into dehydration and also loss of sodium through the sweat. So the most important part would be to really keep yourself hydrated and never get into any dehydration. We need to increase our salt intake in a regular intake of food which we are doing. We can add some top-up salts there. But most important part is that if any patient feels a bit dizzy or not really up to the mark and fatigue kind of situation, you need to meet your doctor to really adjust your medications, especially in such stressful conditions where the dose might have to be slightly increased.
All right. Well, thank you, doctors, for joining us today and telling us all about hormones and health and its relation and how it can be managed, something very invaluable for many of our viewers, I'm sure. Thank you all for watching at home. Goodbye.